This is Dr. Amrish Patel. I'm at TOBI 2019. This is actually my first time at TOBI, and I'm super excited about the things I'm learning here. And there's a lot of really good information out there for patients, especially in the realm of spine and interventional spine. There's a lot of new treatments coming out, but a lot that's not yet known. So I think it's a great organization in terms of how we're getting a lot of information. I think the big key is that now we can translate that information to our patients, really let you guys know what's out there, what's accepted, what's not accepted, what's hokey, what's not hokey, and what we're still trying to learn. I think this conference has given us a lot of insight, which is going to be great because now we can bring that to our patients and actually really educate them on all the fads that are out there, all the procedures that are out there. And being an interventional spine, there's a lot of stuff that we do that's non-surgical. And so what we're trying to do is bring that to our patients and really teach you how to avoid spine surgery if at all possible. That there's a lot of hope out there still. There's a lot of great studies coming out. There's a lot of case series. I think we still got to proceed with caution. We don't have a lot of great data, but I think we're on the cusp of getting a lot of good data that's going to hopefully allow us to bring treatments to our patients that are going to help them definitely get better, not only physically, but even possibly on imaging, which is what a lot of us are concerned about when we see a bad image. So I think it's really good because that'll allow our patients to become hopefully healthier. They'll be able to move better, which will allow them to control their weight, and the things that I focus on, the rehabilitation, their strength, and also really looking at their nutrition. If you're healthier, you feel better, you're more active, you tend to eat healthier, so I think that's something that we can really bring across to our patients using some of these treatments that we're learning about. So they should always ask the provider probably three things. One, what kind of biologics are they going to use? Two, what's the evidence out there on the use of that biologic? And then probably the most important is how many have they done? You're always going to find those people that are just starting to do the procedures. I think there's a lot of false advertising out there on doing these kind of procedures and that you're going to have great pain relief. So as a patient, I would be very mindful of who's doing it and what is their expertise and skill level. There's people out there that have never done a spine procedure that go take a weekend course. So I think that's really what we want people to really focus and understand is who is your provider. If you can't find them on Google and find out who the director of that clinic is, probably need to do a little more research into finding a good provider. Biologics are kind of what we're looking at this conference and saying what are the things that your own body can produce or potentially things that we can get out of a bottle that may be able to help patients actually recover from their symptoms. Kind of moving away from some of the traditional things that are out there that we actually know can actually progress degeneration over time. So biologics, it's not stem cells. Right now we know that there's not really stem cells per se, but there's a lot of signal modifying things in our blood, in our bone marrow, in our fat cells. And so that's really what we're looking at and trying to find out what works and what doesn't work. Well, so honestly, it's really how many procedures have they done to the spine in general. So myself, I've done very little biologics on the spine, but I've done tens of thousands of spine procedures. So I'm very skilled in doing the procedure. Adding the biologic doesn't really change how you're going to do the procedure. It just changes what you're injecting into that area. What you really want to be careful about are people that are advertising it and don't really have a specialty or especially training in spine. So for instance, myself, I'm board certified in physical medicine, rehabilitation, and sports medicine, but I also did a fellowship in interventional spine, which doesn't really have a board certification to it. However, just going through that training already got me the education on how to do these procedures safely and how to do them in the most harmless way. Obviously, all procedures are not comfortable, but again, it's all about doing what's right for the patient, avoiding producing or causing more harm. And I would say the biggest things that I would emphasize for patients is you really got to be accepting of the care that you're going to get from a professional, but also have to take the responsibility of actually following through with the things that we know can help you have the optimal health, not just good health, not just okay health, but really optimizing your chance of recovery. We see this in athletes. Why they tend to respond so well to a lot of these procedures because they're athletes. They're training hard. Their muscles are stronger, but also that kind of stimulates the growth of cells and their own nutrient factors to try to promote healing. So we really want to look at that in the average patient population, right? You don't have to be an athlete. You don't have to run 100 miles. But if you're a fairly active adult, you're going to have better muscle strength. You're going to have better muscle surrounding the structures that are getting injured or damaged. And you're probably going to have better healing factors. And that's really going to optimize your care. A lot of that includes diet, exercise. intermittent fasting, all those things that we know right now are showing signs that it can help improve healing. And I think that's really the big key, is that we got to have patients involved in their care. It's not how I'm going to fix you, it's how I'm going to help you fix yourself with some of these procedures that we're doing, plus optimizing your overall health care. Patients got to take the power in their own hands.